Well, thank you for joining us today. We have been working very hard during the last several months to prepare for a potential fall resurgence of COVID-19. Today will mark the 9th day in a row with our daily case counts reaching more than 1,000 new cases per day. As of midnight, we are reporting 1,276 additional positive cases of COVID-19, which brings our statewide total now to 175,922. We are also tragically reporting 27 additional deaths associated with COVID-19, which brings our total to 8,411. We have 773 patients currently hospitalized, with 83 patients either on a ventilator or receiving a treatment called ECMO, ECMO, with a ventilator. Our healthcare system is reporting that it still has significant capacity available, with nearly 21% of ICU beds available and nearly 19% of medical and surgical beds available. And obviously most of the patients in the hospital are there with other conditions, not COVID-19. However, with the data that we have just reported, we believe that we are at the start of the fall resurgence. And we have been talking about a potential fall resurgence and preparing for that for months. Today, I would like to introduce our team that has been working on our efforts to minimize the impact that the resurgence may have on Pennsylvania and save lives. This team is representative of the entire Department of Health and the Wolf administration that has been working on this effort. I would first like to introduce Michael Huff, and he is the Director of Testing and Contact Tracing, and he will talk today about our antigen test kits and those being distributed, as well as our contact tracing efforts. We'll be introducing Dr. Wendy Brond. She is our COVID-19 Response Director, and she will talk about our monitoring and response efforts. We'll be introducing Deputy Secretary Cindy Finley, who will talk about our vaccine distribution and preparations. And Deputy Secretary Ray Bereshansky, who will talk about our efforts to track and prevent influenza outbreaks so we don't have two health crises occurring at the same time. Your heroic efforts, really our whole team's heroic efforts, have saved thousands of lives, and I would really like to thank our fantastic team at the Pennsylvania Department of Health, as well as the entire administration, who have just been working tirelessly on behalf of individuals in Pennsylvania. And of course, thank the heroic efforts of all of our healthcare personnel in all settings on the front lines of this effort. And I want Pennsylvanians to know that really you have such an important role, maybe the most important role, to play in this effort. This pandemic of COVID-19 has certainly taught us that we are all in this together and we are all interconnected. And we must stand united in stopping the spread of COVID-19. So please, please make sure that you mask up, that you wash up, that you social distance, and download the COVID Alert PA Exposure Notification app, which is really proving to be a very useful tool to us in battling COVID-19. And as always at this time of year, get a flu shot. It's one of the single most important things you could do to protect your health. And now I would like to introduce Director Michael Huff, Director of Testing and Contact Tracing, who will talk about those efforts. Thank you. Director Huff.
Thank you, Secretary Levine. and thank you all for being here. Good morning. The COVID-19 situation is fluid, and guidance continues to change over time, even after plans are prepared and adopted. One thing has not changed. Citizens of Pennsylvania have individual responsibility to contribute to proper behavior and to adhere to public health guidance to protect themselves and others, as well as to help control the spread of COVID-19. Public health controls are only as effective as the willingness of individuals to carry them out. To complement our public health mitigation efforts, the federal government is allocating 150 million Abbott Buy Next Now antigen rapid tests. The federal government, through Abbott, will directly ship 50 million of these tests across the U.S. to personal care facilities, skilled nursing facilities, historically black colleges and universities, home care and hospice organizations, and Indian Health Service. Of the 100 million remaining tests, Pennsylvania is being allocated on a per capita basis over 3.8 million Abbott Buy Next Now antigen rapid tests from now through the end of December. The Pennsylvania Department of Health has already received the first allocation, and shipments of 250,000 tests will continue weekly until the end of December. In addition, the Pennsylvania Department of Health, in partnership with PEMA, is responsible for the distribution, administration, and reporting of the test results. The Abbott Buy Next Now distribution plan includes identifying vulnerable populations in Pennsylvania counties, demonstrating substantial risk for community spread. Weekly distribution will occur to counties that are deemed substantial risk, as well as the top tier of moderate risk, totaling 6 counties per week, and prioritizes those counties that have current outbreaks. Pennsylvania's identified vulnerable populations include skilled nursing facilities, personal care homes, assisted living facilities, independent care facilities, drug and alcohol treatment providers, behavioral health treatment providers, correctional facilities, institutions of higher education, healthcare organizations, and schools and teachers K through 12 in counties demonstrating substantial risk. Pennsylvania's COVID-19 testing goals remain ensuring testing is accessible for all Pennsylvanians with symptoms of COVID-19, available by increasing supply and building capacity, and adaptable to evolving landscape of the virus and data. Pennsylvania continues to expand our contact tracing efforts as well. The mobile app, as mentioned by Secretary Levine, COVID Alert PA, was launched on September 23rd, and to date has nearly 300,000 users. This app allows users to check in daily to report if they're experiencing COVID-19 related symptoms. The app will also alert you if you've been exposed to someone who has tested positive for COVID-19. To date, Pennsylvania has over 1,500 contact tracers working throughout the Commonwealth from over 150 partner organizations. And just last week, the contact tracing management system went live. This system modernizes our public health response by allowing calls and all contact tracing activity to occur out of one program, integrating its data systems, standardizing workflows, and ensuring timely response to increases in contacts. In addition, the Abbott Buy Next Now antigen rapid test to Pennsylvania's COVID-19 testing infrastructure and the tremendous efforts with contact tracing are critical to combating this virus. I'm now pleased to introduce to you Dr. Wendy Brond, the Department of Health COVID-19 Response Director. Dr. Brond?
Thank you, Director Huff. My name is Dr. Wendy Brond. I have the pleasure of serving as Pennsylvania's COVID-19 Response Director. I joined the Pennsylvania Department of Health this July, bringing my experience from serving as the Wyoming State Health Officer and Public Health Division Administrator within the Wyoming Department of Health. In this role, I'm utilizing my training and experience in preventive medicine and public health, and in particular, emergency preparedness and response, to ensure Pennsylvania is doing all we can to fight this virus. I provide strategic guidance to our hardworking team in the department's operations center that compiles and analyzes the data for Pennsylvania's response to contain and mitigate the impacts of COVID-19. Together, we have all worked to ensure that as the situation surrounding COVID-19 evolves on a daily basis, we are prepared to protect Pennsylvanians. We know that this virus has disproportionately affected some of our most vulnerable Pennsylvanians. This includes those in congregate care facilities, such as nursing homes and other long-term care facilities. We perform comprehensive surveillance to identify cases and potential outbreaks and take swift public health action to decrease the likelihood of further spread. We consider one case of COVID-19 in a facility to be an outbreak, and so we are working intently to assist a large number of facilities across the state so that they have the resources available to handle an outbreak at their facility. We are working to ensure that the latest technology and information surrounding the virus is available to these facilities. Whether antigen test cards, as Director Huff just discussed, or the latest information on how to best protect residents from the virus. Since Dr. Levine has mandated universal testing in our long-term care facilities and provided access to efficient testing resources in those facilities, we are able to find cases as soon as possible. Although we are able to produce test results in 24 to 48 hours, near immediate test results would allow us to intervene even more quickly to protect these vulnerable individuals, and these antigen test cards will do just that. Through our surveillance, we track trends and identify hotspots. When case counts decrease, we evaluate what public health strategies were or are most impactful across our Commonwealth. When case counts rise, we attempt to identify the origin or origins of the increase of COVID-19 cases. When we see cases spread in a community, we look at who is most at risk and what resources we can use to assist them. Some of this has occurred through our testing partners, such as our testing sites established in counties with AMI, and our partnership with the Latino Connection and other partners for testing in underserved communities. We are working closely with fellow agencies, such as the Pennsylvania Emergency Management Agency, the Department of Human Services, the Department of Education, and others, to ensure that we are coordinating and working together to assist all stakeholders in need. We have, throughout the pandemic, provided additional forms of data to the public in order to inform what is occurring with the virus in the Commonwealth. The data is part of our role to inform the best public health approach to mitigate the spread of the virus through our surveillance. These best practices are then used to inform other parts of our response to ensure that we are constantly working to protect Pennsylvanians. We are committed to monitoring how COVID-19 affects our state and provide data to inform policy decisions and educate residents. These antigen tests will provide a rapid indication of cases in nursing homes and long-term care facilities, colleges, healthcare providers, and more. We will continue to learn and monitor how COVID-19 affects our friends, our neighbors, and our loved ones. We know all Pennsylvanians are challenged every day with the COVID-19 virus, but please know the sacrifices you make each day to help further protect COVID-19 from spreading. We continue to call on Pennsylvanians to do your part in combating the virus. Please, when you leave your home, wear a mask, practice social distancing, wash your hands, answer the phone when public health professionals and contact tracers call, and download the COVID Alert PA app. Together, we can unite and fight this virus. Now, let me turn it over to Cindy Findley, Deputy Secretary for Health Promotion and Disease Prevention at the Department of Health. Thank you.
Thank you, Dr. Braun. Hello, I'm Cindy Findley, Deputy Secretary for Health Promotion, Disease Prevention. We at the Department of Health have been working closely with our CDC partners on the federal level to plan for the distribution of COVID-19 vaccine when it becomes available. The CDC has provided a playbook for jurisdictions or states to aid in building plans for our vaccine distribution. And we have been utilizing this playbook to help formulate our distribution plan. Our state plan will be submitted this week to CDC. We know that when vaccine becomes available, it will be distributed in a phased approach. With this approach, our plan will continue to be a living document as each phase of distribution is released. Pennsylvania has a unique makeup of rural and urban populations. As such, elements of our state plan have been rigorously reviewed with an internal task force, including PEMA and our emergency preparedness teams. Additionally, we have partnered with external stakeholders to bring a variety of voices. These voices are represented by specialists from a variety of Pennsylvania hospitals, including vaccinologists, gerontologists, ethicists, the Veterans Administration, our county and municipal health departments, our federally qualified health centers, our pharmacists, and our educators. Partners in our sister agencies, such as the Departments of Human Services, Aging, and Community and Economic Development. As we continue to prepare for when vaccine becomes available, we will continue to relay these updates to the vaccine plan and distribution. And now, I would like to welcome Deputy Secretary Ray Bereshansky to speak further about the flu vaccine.
Thank you, Cindy, for that great introduction. I appreciate it. I also want to thank all of my colleagues here today for their continued diligent work to keep Pennsylvanians safe and healthy during the pandemic. My name is Ray Bereshansky. I'm the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. The flu is a major concern for us this fall. While the addition of COVID-19 adds complexity to our overall operations, we started preparing for the 2020-2021 flu season early. Already, there are seasonal flu clinics distributing the flu shot to anyone aged 3 or older to protect against the flu. And just last Monday, our Executive Deputy Secretary, Sarah Boateng, received her flu shot at Penn State Milton Hershey Medical Center and explained about the extreme importance of getting vaccinated for the flu this year. As a reminder, it is safe to go to your doctor's office, pharmacy, walk-in clinic to get your flu vaccine in the form of a shot or nasal spray. This is recommended for anyone ages 6 months or older. Please talk to your healthcare provider to see which flu vaccine is best for you. We recommend you getting your flu vaccine now before flu activity starts to increase in your community, and certainly before the end of October. Remember, getting a flu vaccine will not only just help you from becoming severely ill, but could also protect your family, your friends, frontline healthcare workers, and anyone you may come in contact with this flu season. At the Department of Health, in past years, we've utilized a multidisciplinary working group comprised of both internal and external partners to monitor and respond to flu activity. Internally, we have members from our Bureau of Epidemiology, our state laboratory, the Bureau of Communicable Diseases, and even the Bureau of Public Health Preparedness and our communication teams. Externally, we've had members of the Hospital and Healthcare Association of Pennsylvania, the PA Medical Society, and the PA chapter of the American Academy of Pediatricians. Specifically, this working group has met regularly to discuss flu trends, to review what we're seeing specifically here in regard to flu in Pennsylvania, and also to review any relevant guidance from the federal government. An important aspect of our flu operations includes sharing flu activity data on our website throughout the year, with increased surveillance activities during the flu season. An updated flu activity data is posted to www.health.pa.gov every Tuesday throughout the flu surveillance system. Yesterday was the first report from the 2020-2021 flu season. And these updates provide a summary on when and where flu activity is occurring, current trends in flu as compared to previous seasons, and what types and subtypes of influenza viruses are currently circulating. It's important to note that the flu case counts presented are restricted to the cases that have had a positive laboratory test as reported to the department. In addition, the county table has not posted yet for patient confidentiality reasons, since it is very early in the flu season and we do not have many cases. As you can see, the department and our state partners are working diligently to monitor both COVID as well as the flu, and ultimately prevent a flu epidemic in Pennsylvania within a global pandemic. The safety and health of Pennsylvanians is our number one concern. So remember, cover your coughs and sneezes with your elbow and continue to wear a mask. Clean surfaces that are frequently touched, such as countertops, remotes, doorknobs, and even your smartphone. And contain viruses by staying home if you're sick, by wearing a mask, and by practicing social distancing. Also, as many have said before me, download the COVID Alert PA app to add your phone to our fight against COVID-19. And as Dr. Levine always says, stay calm, stay alert, and stay safe. And with that, I will hand this back to Dr. Levine.
Thank you, Ray. That had a nice ring to it. Now I'm pleased to answer questions with our team. Yes?
Can you explain what you mean by a fall? Can you explain what you mean by a fall resurgence? Are we going back to what we saw in March and April? And then related to that, is Pennsylvania headed toward more stay-at-home orders? At what point do you decide we've reached that tipping point?
Mm-hmm. So it's very hard to predict what the future will bring, but we have been talking for months that we were concerned that as we entered the fall season, as the weather started to change, that we would see a resurgence in terms of the numbers of COVID-19. Also, Pennsylvania clearly is not an island, and we are reflecting what the rest of the country is seeing. In the Midwest, in the Mountain West, and in most states in the United States, they are seeing increasing case counts, and we're seeing that in Pennsylvania. So that's what we mean by a fall resurgence. There's no way to know exactly what the peak will be in terms of the spring versus now, but we're certainly seeing a change in the last number of weeks from what we saw before. We have so much more resources than we had in the past. We have the significantly increased testing that Director Huff was talking about. We have also the case investigations and contact tracing in a much more robust way, as Director Huff was talking about as well. In addition, our healthcare system is better prepared, and we have more PPE than we had in the spring. So, working through containment and other efforts, we have no plans at this time to change the mitigation orders that are already in place. Sure.
Are there specific metrics that would push you towards stay-at-home orders or new business restrictions?
We have no plans to have any further business restrictions or stay-at-home orders at this time. It's impossible for me to predict the future. But again, we're in a much better place than we were in the spring. Yes?
This question is for Dr. Huff.
Great.
Dr. Huff, have you found any kind of link between large events like Williams Grove Racing or the president's trip to HIA and outbreaks or hotspots?
I'm sorry, could you repeat that question?
Have you found any link between large gatherings like the racing at Williams Grove, where 9,000 fans were in the stands with no masks, or the president's visit to HIA for his rally?
That question is probably better answered by Dr. Braun, and so I'll ask Wendy to step forward. Thank you for that question.
Thank you, Director Huff. Thank you for that question. Certainly, there are very good data that show that events, large events, particularly when mask wearing and social distancing are limited, lead to the spread of cases. So it is very likely that situations that you mentioned, in addition with other large gatherings that we see, would lead to an increase in cases. And that's why it's important for people to remember to restrict their activity in gatherings and to practice those important prevention measures like masking and social distancing and hand washing, so that we minimize the likelihood of spread through, in general, and particular in events such as that.
Your team hasn't found specific links from those two events to hotspots or outbreaks?
I'm going to defer to the Secretary.
Okay.
We're a tag team. We have not had specific evidence through our contact tracing of links to the Speedway or to the event in Harrisburg. Again, we are very dependent upon exactly what people tell us. We do ask if they've been to large gatherings. We do ask if they've been to other events, but we have otherwise no way of knowing, and so we don't have that type of granular data that would link into those specific events. But as Dr. Braun said, I mean, it is concerning when there are large events that where people are unmasked and not practice social distancing, and those could lead to to super spreader events. And the super spreader event that we certainly know of is the one at the White House that has been talked about by the CDC and other national figures. So we remain very concerned, but we don't have that specific data that you're looking at. Next question.
What's contributing to the higher spike in numbers that we're seeing? I know a few weeks ago you mentioned college campuses, and then also, are you concerned as we head into the colder months that people are going to start gathering indoors as well?
So that is a significant concern, and why one of the main reasons why we tend to see more flu in the late fall and winter months is that when people spend time indoors, they're more likely to spread these respiratory viruses such as influenza and COVID-19. In terms of the increases, it is really younger people, and I'm using that term broadly now. So it's not just that college age group that we were seeing in September. We're seeing increases in people in their 20s, in their 30s, in their 40s. The director of the CDC has said that it really is small gatherings that tend to be driving this, and I think that we're seeing that in Pennsylvania. That there are some specific outbreaks that we have seen in college campuses, and we have been working with those and working to address that. But it's not as specific as it was. It's really much broader, and that's true not only in Pennsylvania but actually across the country.
Secretary Levine, I don't know if you could kind of define this or bring this in a little bit, but there's a lot of focus on case count. So many folks are just kind of looking at 1,300 or 1,700, and they get a little bit concerned. But when I talked to Shippensburg, they said recently they've seen an uptick in students who want to come in and voluntarily get tested, and they find often that a lot of those students are asymptomatic. So can you kind of talk about the severity of the cases you're seeing, and if it's just a case of we're getting more people tested now than maybe we were in April, or if it is a legitimate uptick that does cause concern?
Sure, it's both. I mean, we are doing significantly more testing than we were able to in the spring. We're averaging almost 30,000 PCR tests per day, and then probably 1,000 to 2,000 antigen test results a day. So we really have expanded our testing dramatically. But it's not only that, because we are seeing the percent positivity start to increase. So we're not past that 5% level that we had talked about before, but we have seen increases in our percent positivity. And also we are seeing our hospitalization rate increase. We have almost doubled our number of hospitalizations per day than approximately a month ago, over 700 patients in the hospital. Now, we're not at where we were in the spring. That was over 3,000 patients in the hospital at the end of April, but it's doubled in the past month. So it's not just an increase in testing or an increase in individuals who aren't ill. It's an increase in individuals who are ill and being hospitalized as well. Those are exactly the same trends that are being seen right across the country. If you look at the number of patients hospitalized in Wisconsin, in North Dakota, in South Dakota, in Nebraska, significant increased rates of hospitalizations. So we know that this is a very dangerous virus.
And then regarding testing, there's been multiple measure studies that show PA is still not meeting the desired testing targets. Advocates, including Pennsylvania Public Interest Research Group, say things such as boosting test purchasing power, increasing the number of variety of testing locations, and an educational campaign to increase awareness are needed. Are there plans to implement some of those specific recommendations?
So we have improved our testing capacity significantly, but I'd like Director Huff to answer that question.
Thank you. Yes, our capacity has increased. We probably have over 400 sites across the Commonwealth that folks can go get tested. One of the challenges for all states has been the supply chain issues surrounding things such as reagent for the PCR, the test kits themselves, the plastics that are made to basically collect the specimen, and that's why you're seeing more focus put on antigen testing. So as we have, as I mentioned earlier, the playing field continues to change, and we keep responding to the playing field. So what we currently have now are the antigen tests, which will really help drive identifying where disease is so that we can put forth our mitigation efforts. In addition, the department is working very hard on a statewide approach to testing that will include the county municipal health departments, who account for 40% of Pennsylvania's population, the FQHCs, federally qualified health centers, who 1 in every 14 Pennsylvanians receive care there, as well as the Department of Health infrastructure that we're continuing to enhance to make certain that these tests are available to any Pennsylvanian who wants them.
I think that Johns Hopkins tracker, they've ranked us, I think, second to last in terms of testing per population. What's your sense of why that is and what the limits are in Pennsylvania?
I think in terms of the way the information is tracked, a lot of states, obviously you see one state. A lot of states were including antigen testing. We weren't. We are now. I think that you will see, relative to our positivity rate and our testing rate, our numbers look better than they did without making any dramatic changes. I think it's the way the data is reported and the way the data is analyzed.
Director, I have one
Yes.
specific answer for that. So after that report by Johns Hopkins, we did a real deep dive into that data. As Director Huff said, different states report information in different ways. Previously, we were reporting the number of patients that were positive, not the number of tests that were done, meaning we were reporting on our website the number of patients that tested positive. That some of those patients, depending upon their symptoms, might have had multiple tests. Other states were reporting each one of those tests. So it was completely apples and oranges. So we have done a very deep dive in terms, we rank somewhere in the 30s in terms of, I don't know what it is this week, in terms of the number of tests that we're doing versus the number of tests of other states are doing. It's certainly not 49th as Johns Hopkins did. It was again, comparing two different things. But more important than exactly the number of tests are the details that Director Huff were talking about in terms of how our whole plan and how we're distributing those tests. So we want our tests to be available, we want our tests to be accessible, and we want to have a very adaptable system. So more than one state doing 30,000 tests a day and another state doing 32,000 tests a day is making sure our system is working, and we think our system is working really well. But again, this is a new program that Director Huff announced today in terms of 250,000 antigen, Binax Now antigen tests that are coming out every week between now and December. And of course, that's going to increase our testing capacity significantly. Yes?
I know you spoke about the distribution plans for a vaccine, but where exactly are we with a vaccine? Just yesterday we reported Johnson & Johnson had to stop their trial for a little bit. So, I know there's plans for distribution, but where exactly are we with that vaccine?
So you're talking about where we are nationally. So there are vaccines that are continuing their clinical trials, particularly the Pfizer vaccine and the Moderna vaccine. There are two vaccines whose trials have been halted. One is the one that you mentioned, and the other is the AstraZeneca one because of a potential side effect in Great Britain. And so that is why we had said that science is going to drive this process, that you can't put a date on when the vaccine is going to be distributed. We have to wait for those clinical trials to unfold. And when the FDA and the NIH and the regulatory bodies say that we have a safe and effective vaccine, then our job will be to work on the distribution and administration of that vaccine. And as Deputy Secretary Finley said, it's going to come out in several stages. What our job is right now is to be completely prepared for when that happens, and that's what we're working on. Back there.
Hello there. Can you explain how those antigen tests work, and then what happens after December when you're not allocated any more of those tests?
And I'm going to refer back to Director Huff.
Thank you. This gives me a great opportunity to demonstrate how this test works. So essentially, it's a card. It's about the size of a credit card. And the credit card is bifold. You open it up. You take a drop of the extractor and you put it in a little circle that's indicated extractor. Then you take the swab and you basically get a sample from the nose. It's not a nasal pharyngeal, it's just the nose. You take that and there's actually a little insert where you would put the swab in the insert to the point that I don't want to say cotton because it's not cotton, but where that soft portion that collects the specimen is over the extractor. You twirl it literally 3 times, you close the card on top of one another, and you wait 15 minutes. In the event you've got a positive, there will be 2 lines on the left and 1 line on the right. If it's negative, you will not have that second line on the left. So it's fairly simple, it's fairly rapid, and that it's a very useful tool in our toolkit with the other types of tests we have available to really address where the disease is and then put mitigation efforts in place.
Dr. Levine, I'll let you get to the podium. The question is, have you talked about or thought about revising guidelines for K through 12 schools?
So with the Department of Education, at the request of the superintendents, we put out guidelines in terms of for schools to consider whether the learning should be remote in very high areas that have substantial spread of COVID-19, whether to have more of a blended system, or whether if there's low community transmission, to have in-person education. We have no plans to update those guidance, but I want to recommend or emphasize that there is local control, that this is really up to the superintendent and the school boards to decide, but we have no plans to change that guidance at this time.
And should Pennsylvanians feel safe attending an Eagles game with 7,500 people on Sunday? And just related to that, have you done any measurements or seen any results of the Pittsburgh game this past Sunday?
So we have not seen any data from the Pittsburgh game. Again, the incubation period for the virus is up to 2 weeks. And so it would be it's only been a couple of days. It'd be way too early to see anything. We have seen data, though, from the NFL. So as we have spoken with the Pittsburgh Steelers and the Philadelphia Eagles, we have spoken with their medical directors and their medical personnel, and we have looked at data from previous NFL games that have had fans in the stadiums, and we have not seen any evidence of significant increases due to those games. We'll be watching to see what happens in Pittsburgh, and I think that fans should feel safe. I mean, I think the Philadelphia Eagles have really robust protections in place for the fans that will be entering. Everyone will be wearing masks. Everyone will be socially distanced. They have plans in terms of, in terms of the bathrooms and things like that. So we feel very confident in the plans that the Philadelphia Eagles have put forward.
Thank you.
Thank you very much.